There are so many cough and cold medications on the shelves that I know it is confusing to figure out which one you need. So I'm here to help you figure it out. I've got lots of tips for you. So honestly, let's jump right in. Now, before you even go to the drugstore looking for something for your cough and cold symptoms, first thing I want you to do is to go to your own medicine cabinet. That's right. Go to your own medicine cabinet and check out what you already have and look at expiration dates. Guys, we have to remember these products do expire. This is a good opportunity to clean out all that old stuff that's expiring because you don't want to use that and take stock of what you have and what you need. All right, so once you've gotten rid of all the expired stuff, there's a couple things I definitely recommend that every household have, and that is sort of a pain reliever, fever reducer, okay? That would be something like acetaminophen, which is a Tylenol, and I would say ibuprofen, which is also considered like Motrin or Advil or things like that. Now, you should check with your doctor to find out that it's okay and to make sure that it's okay for you to take Tylenol and or Motrin. There are some people that should avoid one or both of those medications. But I do think for generals, like as a general recommendation for most people who don't have any contraindications, that having like Tylenol and Motrin in your house is a great thing to do. Okay, now let's go into the cough and cold medications that are on the shelves. When you get to the CVS or the Walgreens, you're like, oh my gosh, I'm just so stubby. I need some medications. What do I pick? You know that feeling. First category is expectorants. That is a class of medication that helps thin mucus so that you can cough up the congestion in your chest. You can sort of cough and spit it out. We want you guys to do that. We want everyone to do that, as gross as it may seem. The ingredient, sort of the name is guaifenesin. So if you see that word guaifenesin, understand that it is an expectorant. It helps thin mucus so that you can cough up mucus and clear your airways. That's really important. Okay, next category is decongestants. I know you've heard about this. Decongestants help relieve sinus pressure and congestion, which can be very, very helpful when we have a cold. And by the way, I'm not telling you to get all of these things. I'm explaining. I want to explain what all of these things are first of all, okay? And then I'll tell you how to choose. So decongestants help relieve sinus congestion and pressure. Some of the names that you may see are phenylephrine or pseudoephedrine. Now, you got to be careful with decongestants because there's a few caveats. Number one, they can have side effects that are not so great for certain people. Namely, they can raise blood pressure in some people. They can have other side effects. You've got to check with your doctor before you start taking any sort of decongestant. You got to make sure that it's okay. Decongestants really work by reducing the swelling of blood vessels in the nasal passages. So that allows you to sort of breathe and sort of relieve that sinus congestion, which is really kind of cool. But there are many nasal decongestants, like say some of those in the nasal spray form, that you can only take for a couple of days and then you must stop. You've got to read instructions very closely with decongestants. You got to check with your doctor first to make sure you're even allowed to take them. And then something else I want you to understand is that some people unfortunately use decongestants illegally to make illicit drug substances. That's one of the reasons why a lot of these products are actually behind lock and key, okay? So keep in mind that's really important. Also, decongestants can interact with other medications you are on. So once again, you do want to check with your doctor before you take them. But remember, decongestants, that's things like pseudoephedrine and phenylephrine. These are medications that help relieve sinus congestion and pressure. Okay, moving on to the next category. Let's say you have a cough. You're just coughing and coughing all over the place. You want an antitussive. An antitussive is a category of medication that's just what it sounds. It suppresses coughs. And one of the common ingredients that we see in products over the counter is an ingredient called dextromethorphan. If you see dextromethorphan, that is the name for an antitussive, something that helps you sort of suppress a cough. Now, I think it's really interesting how these work. So antitussives often work by decreasing activity in the part of the brain that causes coughing. Who would have known? I think it's kind of interesting, don't you think? Also, you may find antihistamines in some of your cough and cold medications, okay? I know you're familiar with antihistamines. Oftentimes we think about them in terms of allergies and allergy symptoms. Keep in mind that there are two sort of generations of antihistamines. We've got the first generation antihistamines, second generation. I guess I don't want to get too techie, but first generations are older antihistamines that tend to cause a lot of sedation and sleepiness and tiredness and things like that. Can increase the risk of falls in older folks and things. Second generation antihistamines tend to have less of the sort of sedation side effects and things like that. But you may find an antihistamine as part of a cough and cold medicine. Just wanted to let you know that that may be something that you see. Now, so you say, well, so how do I find a medication? So well, how am I supposed to pick? You gave me all these things. What am I supposed to do, Dr. Jen? Well, that's a good question. That's why I'm here. So this is what I suggest. First of all, is take stock of your symptoms and look for a medication that primarily combats the symptom that you have or symptoms. In other words, it doesn't pay off to take a medication that's going to get a lot of different symptoms if you don't have those symptoms. So only target medications that deal with the symptoms you have. Don't just sort of do I'm going to get everything because that must be better, right? No, not necessarily. In fact, it could cause potential side effects if you're taking medications you don't need. So target the symptoms, think about what symptoms you have, and then look for a medication that will help with that. Remember, I keep saying this, I know I sound like a broken record. You want to check with your doctor first because not all medications will be okay for you. Remember not to mix medications. Do not mix over-the-counter medications. And once again, be careful with taking over-the-counter medications with your prescription medications. That's why I keep saying check with your doctor, because sometimes there can be interactions. And the other thing I want to say too is, you know how in the beginning of this video I was saying you should have like a Tylenol and a Motrin just on hand. Make sure that you're able to take it based on your medical conditions, but I think those are great fever reducers, pain reducers, etc. Keep in mind that many over-the-counter cough and cold medications actually have either the equivalent of Tylenol, acetaminophen, or Motrin, ibuprofen in them. So you want to know if your cough or cold medicine already has that in there, so you're not taking an extra medication, an extra dose of it, okay, on top of it. So be very, very careful. Take only the amount that's recommended for your over-the-counter cough and cold medications. Do not take more medications because, of course, that can have side effects as well. Guys, I hope that's helpful. It's sort of a general overview of how to look at this. Guys, remember to wear your mask, wash your hands, social distance, use hand sanitizer, all that good stuff. If you have to cough or sneeze, do so in a Kleenex, okay, not into your hand. Those are really important measures, especially during this COVID, cold, and flu season. Guys, I'm Dr. Jen Caudle. Thank you so much for watching this video. Please consider sharing it with other people. And if you haven't subscribed to my channel, I invite you to do so, guys. I will see you soon.